public health promotes and protects people in the communities in which they live in. Typically with public health services, you'll see immunizations, HIV, STD, counseling and testing, environmental health regulations and monitoring, and chronic disease services. Chronic disease are health outcomes that are typically not infectious and they have more of a lasting effect. Examples would be heart disease, diabetes. Infectious diseases or acute diseases, those are typically short-term. People get over them a little bit quicker, and sometimes we have vaccines to help protect, and they're usually infectious or contagious. Those would be examples like whooping cough, the bacteria that cause foodborne outbreaks, measles, those kinds of things. So our service section is the Chronic Disease Prevention and Health Promotion Service section. We have several programs. One is called Care for Yourself. That program actually helps provide services so women can get cancer and cervical cancer screenings. It does help pay for the services. We also have a Healthy Living Clinic, and that's for individuals that are 50 and older. It provides a free opportunity to sit down with a registered nurse, talk about health issues, education, get a head-to-toe assessment with a nurse for about an hour and a half. So that's a really neat service that we can provide. We have a diabetes prevention program. That's for individuals that are 18 and older, and that is really to help learn new lifestyle changes, healthy eating, increasing exercise and activity, and learning how to cope with those times that maybe we don't make the best choices. We have health and nutrition coaching, and so I have 2 health coaches and a registered dietitian that can provide some health coaching, biometric testing, like checking your cholesterol and your glucose levels. So we have a wide range of wellness programs out there for that. We also have a worksite wellness program where my dietitian and health promotion service manager will go out to the work sites and kind of provide similar services that we do here at Public Health. We have a tobacco and youth vaping prevention program, making sure that we're getting education and strategies out to the community for people to not start smoking and vaping, and to also help people that have started and want to quit. And then we also work with the communities within our county to figure out ways that we can make their environment more healthy, to be able to help individuals access healthier foods, increase their activity, and making sure that those areas are safe for them to be able to do that too. Chronic diseases can actually be life-altering and sometimes life-threatening, not only to the individual altering life, but actually the family members. We find people that have chronic diseases, the things that they used to be able to do is hard for them now. Fatigue, sometimes weight gain that is making it harder for you to be active. There are some depression that comes along with that sometimes, and eventually isolation. People just don't want to come out and do things and be around people like they used to. So it's really important that we take time out of our day to go ahead and make healthy choices for ourselves. Go outside, take a walk, get some fresh air, take the dog for a walk, go for a walk with your family member or neighbor, and just get some social interaction. Regular checkup every year with our doctor. Get those cancer screening programs that they are recommending at certain ages too, because cancer is one of those, if it's caught early, it's much more successful in treatment, and sometimes we put those to a side. So that is very important as well. Put down the potato chips and grab an apple when we're sitting down and having snacks or even meals, making sure that you're taking some of those or picking some of those healthy choices. Putting pop away and juices and really increasing our water intake as well. Obesity, overweight and obesity is one of the main causes to a lot of our chronic illnesses, including cancer. And so as a whole, we need to do better and be better in making ourselves healthy so that we can be around and enjoy life the way that we're meant to.